I came back for the night shift again. The entire set of patients had changed. So you just have to realize like 12 patients died in the span of 12 hours. The worst part was when COVID came to my house and my parents got affected.
Hello, everybody. Welcome to another episode of Capes of India, an initiative started by KNYA Med, where we celebrate inspiring stories of different medical professionals all across the globe. Today, we have Dr. Sourav Sarkar with us. He is an MD anesthesia and critical care resident. Dr. Sourav, thank you so much for joining us today and taking out time for this.
Thank you so much, Ushma. Thank you for having me here.
So, Dr. Saurav, we initially read your story, and we came across a part where you said that it was very difficult for you to play a role of a son and a doctor. Could you please share that story with us?
This particular story goes back to 2 years from now. Basically, it happened in the year of 2021, where India was hit by the second wave of COVID. And this was right after Holi, in the month of April, May, where I was working at a hospital in my hometown, which is Ranchi. So just to start with, Ranchi was one of the worst hit cities in the entire country. It was being compared to that of Mumbai because of the density of the population and the lack of healthcare, basically. So people were like very fearful of what could happen, and there was a drastic scarcity of beds and medicines available across the state. So if anyone like remotely is connected to a hospital or a healthcare system, then they would continuously be getting calls ki bed arrange karwa do, dawaiyan mangwa do, do you have someone who can get me in touch with some medical help in any way. So that's when my phone started ringing for asking the availability of beds and if I can arrange a bed in my particular hospital. It was very difficult for at times to refuse as well, but then I was trying to work as much as possible in the midst of all this chaos in between the COVID patients, taking all the necessary precautions that we were. The worst part was when COVID came to my house and my parents got affected. So initially, my mother got admitted to the hospital. She did not get very serious with the disease, but she was kept under observation and she underwent the treatment. But the day my mother got discharged, my father got admitted. And just to let you know, my father's a doctor as well. He's a pulmonologist in the city. And I had been discussing the disease, like it is a doctor's family. I'm a doctor, my father's a doctor, even my brother is a doctor for that matter. And medicine for that matter is our drawing room conversations. We discuss patients, we discuss how the treatment was done, or we discuss rare cases or whatever. And then I see the doctor of our house becoming a patient. So he got admitted and unfortunately, he got a little critical. He was on the verge of getting into the ICU. And at that very point, I am in the same hospital looking after other patients, but you can't work with a clear mind because you see your father getting serious as well. And you know how deadly this disease is. You know what's the worst that could happen. Because there had been days when at work that I left after a night shift. I left at 8 in the morning and I came back for the night shift again. The entire set of patients had changed. It was a 12-bedded ICU and it was a new set of patients. So you just have to realize like 12 patients died in a span of 12 hours, right? So I used to sit with my father. I used to sit right next to him, continuously still discussing patients because I did not want that man to stay there alone and get weak on his mind and overthinking, because obviously overthinking never results in anything good. He's just continuously getting depressed rather than that. I would like to sit right next to him and help him out, just come out of it in a strong way. So at that point of time, I realized that being a critical care doctor, being in the ICU, gives you a lot of liberty to understand and judge and be a little aggressive on the treatment, take it, handle everything in a little more brave manner rather than be at the back foot and just trying to analyze what is happening. Obviously that comes as well, but that's where critical care happened.
Looks like it was a very difficult journey for you. I cannot imagine, the pain that you must have, gone through. If you don't mind me asking, how did you deal with all of these things mentally, knowing that there's a different set of 12 patients that changes overnight, and your father also being in the same hospital where you're working? how did this affect you along with the second hit of COVID?
To be very honest, when my father got into the hospital, I was a little shaken. When I would be alone, I would keep thinking of my father, obviously. But when in that ICU, when handling other patients, I would be completely dedicated to that. And obviously, we need to have a clear one-track mind when handling patients. Otherwise, something or the other will be missed. And again, like, even though I know my father's in the next room, but there's this person who is a father of someone else's. So I have to treat him or try to save him with all my might and all my efforts and the entire team.
That's very right. That's very right. This has been really great. I hope your family is doing okay now. And could you also share a bit about how your days were on an overall basis during the second wave of COVID?
So I remember my head of the department, we had a meeting and we kept half of the staff in reserve, whereas we were working in a half-staffed strength, so that if someone at work gets affected, we can just replace that person with another person who's kept in reserve. So there were times that we had to work over around, say, 90 hours or 100 hours a week. And we would continuously be shifting at max like 24-hour shifts, and then a 12-hour gap, then another 24 or 36-hour shifts. And in the meantime, whenever I would get gaps, obviously I would try to take a nap, have the food that basically is required. And what I also started doing was get on social media, right? So there were nights when there's something called Twitter Spaces. I don't know how many people watching this video would be aware of that, but it's basically an audio platform which is there integrated in Twitter. And there are speakers and hosts, and there are a number of people who can listen and ask questions. It's an audio thing, not a video thing. So we would get on Twitter Spaces, and literally there were, like, for weeks together, we would be answering 100 to 150 questions in a night. Okay, the same questions would repeat, but like every person who would get a chance to ask the question, they would ask questions customized to their own case scenario. They would ask about their parents, their children. Slowly, when this kept on going, we also realized that a lot of people are facing all this issue mentally as well. So we also started keeping mental health sessions, where we would just like ask people to speak up. Whenever they are arrested in their house, you can just talk on the Twitter Spaces, and there's someone or the other who's ready to listen to you.
So, do you have any message to the viewers who will be watching this video?
There's no message concerned with COVID as for now. But for doctors who are seeing this, for youngsters who are just doing their MBBS or who are just going to pursue their MD in the near future, giving the exam probably, which is going to happen in the month of March. So I have been NEET aspirant for 3 years before I got my seat, right? And it's a very tough position to be in, where you are a doctor but still not worth anything as per the norms or as per the society that we live in. But let me tell you that you just need to put in all the effort for once and cross on the other side, and it is really going to be a new challenge. So you never are going to think that acha ye ho gaya to fir my life is sorted. It will never be that sorted. You have to get a new set of challenges every now and then. Okay, so obviously getting stuck at one place is more frustrating, but moving on and crossing that line and going to the other side and giving opportunities to yourself to handle new challenges is what you should look upon. So just give one full fight to this exam, give one full attempt, अपनी सारी कोशिश डाल दो इस चीज में, and then when you cross the other side, when you get the branch of your choice, you will know that it's a personal win. Okay, you win personally, and then it gives you a lot of strength to fight forward. So don't just sulk where you are. Just cross and come over to the other side. That's all I have to say.
Great. I absolutely agree with you, and I really hope that a lot of people can understand this and can actually implement in their lives. Dr. Saurav, this was a great session. It was really nice having you here. Thank you so much, Doctor.